I was in about junior high. I knew I was going to be a nurse. I knew I wanted to go into the medical field. I had talked with some guidance counselors. At high school, I had taken some pre-extended science classes in my high school, so then I was able to get quite a bit of prereqs done while a senior in high school for my nursing program, and then I went right into the nursing program, and I've been a nurse ever since I was 20. I think nurses as a whole kind of make hospitals run. I don't think hospitals could quite function the way they do without nurses. Coming into work every day, leaving my house, I know that there's an opportunity to save a life, and I'm likely going to do that. I'm either going to save someone's life, hopefully change somebody's life for the better. We're in the business of saving lives, and that's just something that, you can't compete with. There's no greater feeling than that.
We work on medical equipment that gets connected to the patient, monitors, anesthesia machines, just pretty much any piece of equipment that is used for the patient. Repair can be anything from like an actual physically broken piece of equipment to maybe some of the software is not working correctly. And so we use different simulators to simulate a patient, and then we can with that, we can test to see if the piece of machinery is reacting the way it should be. To be successful in this career, I would say that you would need to have quite a bit of patience, have very good communication skills, because the information that you receive from the user really helps a lot. So that's kind of the thing that I like the most. Over time, you get to know the people that you're working with, and it becomes kind of like a family.
I have always known I wanted to do something medical. I just wasn't entirely sure what that was going to be. I tried being an EMT for a little while and discovered that was not for me. I wasn't as good with patient care and making really big snap decisions like that. Then I went to college and I did biology just as kind of a blanket, we'll see where I end up kind of a thing. While I was at college, one of my professors recommended this program to me and this profession to me as something that might be a good fit. And once I heard about it, I went to an information kind of meeting, and I knew it was going to be perfect for me. There's no patient contact, but you're still involved in how they're getting treated. You still have this patient advocacy of making sure that they're not overcharged for something or double charged for something and trying to make someone's worst time better. So I wanted to be an ER nurse for a while, and once I heard about this, I realized this was pretty perfect for me.
The most important part about my job is really the patient experience, really putting those patients first. And for an example, making sure as a housekeeper, we are going into the room, introducing ourselves with our name, and just letting them know that we are to take care. We're here to take care of them. Sometimes these families, unfortunately, their families may live out of state, out the country, and they don't have people to talk to and etc. So I make sure to have a short, brief conversation with the patient, just letting them know I'm here to take care of them. And even though I may not be a doctor, but I'm gonna make sure their room is nice and clean so they feel comfortable. Yeah, working in a hospital for environmental services is definitely rewarding. There are pathways to lead you to different steps onto. When I first came into the hospital, a few months came around, just proved myself that I was a great worker, and then I saw that it was actually more to the job, and just about a month ago I actually just got promoted to be an environmental service supervisor.
What inspires me is, I think, knowing that I'm helping fix an issue, especially in the operating room. So a patient comes in, they have something wrong with them, and we go in and fix it. So that is really satisfying to me. It's just nice knowing that after that procedure, the patient is better off and will hopefully progress in the right direction. I would tell someone who is interested in becoming a nurse that if they're looking for a rewarding job that's, mentally, like you feel like you're doing something for society, I definitely recommend being a nurse. I think the schedule flexibility is also really nice. Some people do 3/12s, others use 4/10s or 5 8-hour shifts, so you definitely have a lot of variability with that. with that being said, you have to be open to working night shift here and there and taking calls. So that's a part of the job.